Welcome back. Thanks for being with us here on Morning Live. Now, World Health Organization Director General Tedros Adhanom Ghebreyesus has once again pleaded with Tanzania to take action against the spread of COVID-19. And this following President John Magufuli downplaying the virus. In addition, Tanzania has not shared coronavirus infection numbers since the early part of the pandemic and decided against vaccinating. And to discuss this further, we're joined by Advocate Sipho Mantula, who's a researcher at the University of South Africa's Thabo Mbeki School of Public and International Affairs. Advocate Mantula, thanks for your time. Welcome to Morning Live.
Thank you, Sister Sakina. Refresh morning and Jumbo Africa to our viewers.
Jumbo indeed. So we look at what's been happening in Tanzania, and it has been quite widely reported. We know that they haven't, and I actually looked at the timeline, around May the 12th was the last time that there was any sort of reportage on numbers of COVID-19 in Tanzania. There had been a little bit done before that point. But what is your view on what exactly is going on in Tanzania right now with regard to protecting citizens in that country against COVID-19?
Sister Sakina, remember that it is almost a year when we're doing an insert on Burundi, and I was talking about the SADC chair, that Tanzania has not been reporting on COVID-19. They have their own view, and their view, one can say there is an element of culture, religion, and hence you will understand that even politics of the COVID, what one can say that the disease or the pandemic diplomacy during that time. He was the chair of SADC. He went to the virtual summit on SADC in Mozambique, still denying that there is COVID. And remember that for some of us, what we have been observing, it is the issue that even when the AU, when the SADC region, when the East Africa went on a hush down lockdowns, or what we called COVID regulations, now starting to now close borders. Tanzania relatively went that route. There was even closing of schools. It is only that peak that you have alluded to, that between May and June there was a relaxation, and Tanzania felt that they have already managed to defeat COVID-19, which was the first wave during that time.
Now, from there on in, we know that the president then spoke about prayer, and, you know, that they would get rid of this virus through prayer, of this disease. And then, of course, said that people in his country don't need to wear masks. But, you know, the question that people are asking is whether this is indeed denialism, or is this just a president who believes in African medicine? What's your view?
No, definitely. But, you know, Sister Sakina, one can say the Magufulification of COVID-19 or virus comes from the idea that you will understand that since last year, he has been urging on the issue of African alternatives. He has been raising the issue now, but now beyond denialism, he's now pushing to say people must wear the local mask. He's actually, one can say, anti-European thinking and thought of how to deal with this epidemic. One cannot say Tanzania is not fully aware, with their neighbor being DRC Congo, that they went through Ebola crisis. Even now, we are talking of Ebola revisiting the Western African region. But the issue even of the health system, denialism cannot come at the price where they've lost many people, and it's only now when Zanzibar had their own senior leader who have passed on, who was buried in the island of Pemba, then we know that the presidency is worried, but they are still questioning the issues of the vaccine. Now we've moved from disease diplomacy, we are in the vaccine diplomacy once more. The president of Tanzania is still stubborn, and he has been joined by Burundi, by the way, and there is even a sense that they are looking at an East Africa model of to deal with this epidemic.
At what cost, though, as you mentioned there, Advocate Mantula, the Vice President of Zanzibar, Saif Sharif Hamad, he passed away, and then also the head of the civil service in Tanzania, John Kijazi, he died on Wednesday. And even then, the President, Magufuli, referred to it as the respiratory disease, not even calling it, COVID-19. So how exactly are they then to deal with this?
Sister Sakina, again, semantics, terminologies that come from John Pombe, Magufuli. The issue that you are raising, it is true that I was picking up those lines of saying respiratory, but we have seen in the SADC region, in the African region, in West Africa, senior leaders who have just passed on. Zimbabwe, we have a case study of ministers who have just passed on. Ghana as well, when you think of West Africa, East Africa as well. And even before, when COVID came and visited Tanzania last year, members of parliament passed on. So it is the issue that you can think that Tanzania have their own ideology of understanding this issue of the pandemic, and maybe they are sending signs to the AU to can think deeper, because the issues of health infrastructure, it is who it is pushing now to say, but share this data so that we know how many people have survived, how many people have got the second wave. Because remember, tourism has been thriving in the islands of Zanzibar from European tourists. So that's where even the spread of the virus have increased. But Africa has to really engage on this issue post-COVID, Sister Sakina, because I think Tanzania, there is something that we can learn from.
So let's talk about that. What are the lessons that we can learn from Tanzania at this stage?
Sister Sakina, beyond religious sermons and thinking of praying and steaming, I think there are issues of how they have handled the issue of the public health system, the issue of how they have handled the economy. But remember, I don't want to mince my words to say that even last year they had a clash with Kenya, actually with their truck drivers, because some of the issues of their communities were still having the virus and they were not allowed to go into Kenya. Maybe the other lesson is to understand that maybe Tanzania is bringing the issues of socialism again, to be saying, produce your own masks, produce your own vaccine, look at your health system. But I think the lessons that we cannot learn from but can unlearn is the issue of being stubborn, is the issue of being ignorant of the current situation and not bringing the SADC into the picture. Because remember that this is a former head of SADC, this is a member of SADC, this is a member of the AU. So Tanzania as a country must bring the African region into the knowledge of even culture, spirituality. If they are talking of steaming beyond the churches, beyond religion, what is it that we can master? And that's where I think those are the lessons that we can think that can come from the land of Tanzania, Dodoma, Dar es Salaam.
So if we look at the response to date, the attitude from the president, and we now hear that the World Health Organization has come out very clearly, talking about the behavior of Tanzania at this stage. So it is clear they are defying the World Health Organization, and some would say they are showing total disregard for the organization by doing so. Again, what's your take on that, and at what cost are they doing this, not just to neighboring countries, but to this fight against COVID-19 in general?
Disappointing, actually, because the issue of defying the World Health Organization is the same tactic that they played last year. Remember that African Union Center as well in Addis Ababa last year, August, asked for the data, asked for the even cooperation of dealing with the COVID-19 awareness. But at the same time, WHO Regional Director Mutsie, he has been very critical on asking that Tanzania should at least comply with the norms and standards of COVID-19. You could see their minister, Dorothy Gwajima, when he's going on the press briefing, he doesn't wear a mask, there is no physical distancing. They are very clear even now, early this month, that they are not going to allow any vaccine to can come in. But we cannot wait for the World Health Organization when actually the regional health bodies have to be the ones reminding them. You'll understand that Tanzanian legal minds have already entered this matter to be saying the government should not deny that there is a crisis and it's a health crisis. They should engage on the active measures. And that's where you can see that the issue of not listening to the regional bodies have not only started this year, it has been something that Tanzania has ignored from the African Union Center of Disease Control. Remember that is the main cracks that they have defied their regional body, they're even defying the international body. But it will be important for their legal minds, for their public service, community activists in that country to engage on this health intervention of how to come out of this COVID-19 situation.
So, Advocate Mantula, are you aware of any other government or regional body, be it the African Union or anyone else, having open or public bilateral discussions with Tanzania and its government regarding this?
Not really, Sister Sakina. I'm not yet certain, but like I said, being a member state of the SADC and the AU, Tanzania have their, what you call the principle that they are independent. Remember that even if you have an AU constitutive act, and the issue of not sharing data, by the way, to the viewers, it is not the first country. You have the North Korea that have not shared their data. You have Turkmenistan, that is another country in far Europe that has not shared their data. Whether they have shared bilateral or not, remember that South Africa is trading with Tanzania. We have an embassy there. We've got even business community that has been there. We have been trading with them, Sister Sakina. One can say that what Tanzania actually is doing is to even defy the global order around COVID-19. And that's where I think many African countries in their bilateral is to understand the politics of the virus, understand ideologies around this virus. And I think Tanzania, it is within their right. But at the same time, the cost becomes of the right to protect its citizens. Should there be any challenges, I can assure you the government of Tanzania and the health ministry might be dragged towards the African Commission. They might be dragged against the African Court on Human and People's Rights before ICC, because that's how African leaders must think, because the right to health, it equates to the right to life.
And then, of course, there is also the very dubious question of receiving aid to fight COVID-19. And in November, at the European Parliament in Brussels, Tanzania and Ethiopia were highlighted because Tanzania has, in fact, received money, COVID-19 funds, to fight this pandemic, and they are asked to account for that.
That is shocking, but Sister Sakina, that on the COVAX facility, they were denying that they are not part of the vaccine. Remember that Tanzania, what it has done, actually, when one think of their role in the global scene or in the African scene, they have been pushing the Umhlonyane was in Madagascar, Sister Sakina. Remember when this issue started, they were talking about Madagascar, that we have procured the COVID organics that are from Ghana. And that's where one can think deeply about their thinking. But if they go to the EU with the hypocrisy of not being clear that some of their governments have received the vaccine, that will be injustice, that will be unfair to the broader global media when they are anti-vaccine. But I can assure you, the main issue that I have known, they've been pro-African medicinal intervention. They have supported Madagascar, the same like Guinea Conakry and other African countries who have been emphasizing on looking at an African solution. And I think the issue of the vaccine, their view, it is being rushed, that while you had no vaccine for Ebola, HIV, AIDS, malaria, but you rushed for this one of COVID-19. And I think the issues of ideology, again, the issue of coming of religion, the issues of economy, because he has denied that economy has been hampered, and which is partly true, because tourism has thrived earlier, and you look at the schools, the schools were only closed for almost 2 months. So if you look at his thinking, he has been very clear, President John Magufuli. But like I said to Sister Sakina, it's shocking when you have these bilaterals with European countries, when at the same time you are anti-European vaccine.
And then perhaps just if people missed it, Tanzania received more funds and relief packages from other sources as well. And it talks here about $14.3 million of COVID-related debt relief from the International Monetary Fund in June. And this after they had stopped They had already stopped, giving any sort of updates on their COVID-19 numbers. Then in September, they borrowed $3.79 million US from the World Bank to support laboratory diagnosis and management of COVID-19 cases, which we'd already established they stopped reporting on earlier in the year, around May. And in October, a further 50.7 million rand loan was approved by the African Development Bank as a COVID-19 crisis response budget support. So how do you explain all of that to a country that says we don't have a problem with COVID-19?
No, correctly. I think that is a pure hypocrisy. But at the same time, like I will say to you that the issues of COVID-19 have been treated as national secrecy in most of the African countries. The issue of health virus, the issues of information circulation, even the media, there are many radio broadcasters that were being shut down, whether private or not, last year, because of the messaging around what information that you have shared. And even in some instances, that's why there will be even denial on the defining of the health problem that this is COVID-19. The same issues that we have raised of the package, the relief that they've been receiving. And that's where you find the hypocrisy even of the member states of SADC, of the AU, not having engaged Tanzania on this messaging, on this politics of COVID-19. And like I've said to you, it will be important when you look even at the ministers of finance, when you look at the G7, when they'll be meeting this week, about how they look at the so-called emerging developing countries. As they will always say, Tanzania, it is still developing country, but we saw that the issues of them borrowing again is what even South Africa has went through by borrowing from IMF, but accountability is what we should be pursuing. And I think that's where we should adjudicate, audit or assess Tanzania based on how did they spend those monies, and even when they are in denial of COVID-19. Hence, in most of the African countries, Sister Sakina, we have the COVID-19 scandal or gate that is moving around in terms of the misusing of these funds. And at the same time, you have the health system that has failed, that is even going into the trenches of not people maintaining the health system. So I can say to you, those reports are critical, but like I said to you, most of the issues of health in Tanzania, they are kept within intelligence circles.
Well, Advocate Mantula, we have to leave it there, but thank you so much for engaging us this morning. Advocate Sipho Mantula is a researcher at UNISA's Thabo Mbeki School of Public and International Affairs, giving us his insights into the COVID-19 pandemic and the situation as it pertains to Tanzania, where it is very interesting. Lots of money, but the country seems in denial about COVID-19 and they haven't even reported in terms of the latest statistics, but that's where it's at. We have a few more minutes.